Greetings. I want to talk about tonsillitis. Tonsillitis. That's the diagram of a picture of tonsils, right? Tonsils are structures in the throat, right? They are on the sides of the throat. You know what they do? They help to prevent bacteria or viruses from getting into the stomach, the intestines, and the rest to cause infection. So they are there. So, like, they are part of the immune system, right? They are just in the throat. They are just like the gatekeepers or the soldiers of the throat. They prevent infection from getting in. Sometimes these tonsils, you can see them. Sometimes these tonsils can get infected, right? And when they get infected, they will become very swollen, right? They become swollen, they become red, and they become painful, right? And when they become infected, the child will be having problem with swallowing, right? The baby will be very uncomfortable. Baby is always crying, having fever. Anytime the child will not even want to eat because anytime the child eats and swallows, throat will be pain. You see, they will tell you that their throat is paining them, right? And there's this type of fever in tonsils, in tonsillitis. It's different from the fever you see in malaria, right? The fever in tonsillitis is continuous. You know, malaria fever, it comes in the morning when the sun is shining, the sun is about coming up. Then during the day, it goes down. The baby feels like he or she is better. Then in the evening, the baby goes down again. The fever comes on. But in tonsils, the fever, the temperature is just there. It does not go up. It does not come down, right? Even when you give paracetamol, it goes small. It reduces. It calms down a little, then picks up again. And these tonsils, sometimes it can be so bad that the child will be drooling saliva. Child will not even be able to swallow. The child will just. Have you ever had sore throat? That's what they call sore throat. All those things we are talking about is what you call. You have had sore throat now. That explains everything. You see the way you feel when you have sore throat. It's worse in babies. It's worse in babies. You don't feel comfortable. You can't eat. You can't even talk very well. You can't swallow saliva. It's like that in babies too. So this thing, this tonsillitis, it can continue in that manner to the extent that it can now form pus, abscess, right? And when you look at like this picture you are seeing now, you can see how infected the inflammatory changes in the tonsils is reddened and the rest. It can be so big. I used to have a roommate then when we just started 100 level. We just started 100 level then. He was in engineering. I was in this. I used to have a roommate that had tonsillitis. Was still very, we entered school very young. He could not swallow. He was admitted. This is a teenager I'm telling you about. He was admitted. If he can have, he could not talk. If he's talking, look as if he has potato in his mouth. His body was hot. He was rushed to the hospital. He was admitted. He could not swallow. Could not swallow. So what I'm trying to tell you is that it can also happen like that in a baby. Baby will not be able to swallow. Baby will not be able to. The baby will be vomiting. Anything baby put in will vomit it because it cannot swallow. So that's tonsillitis. The good thing is that it can be treated with antibiotics, and it's not the antibiotic you will be taking at home. You have to go to the hospital, especially for babies. If that temperature that is not going down continue, the child will start convulsing. So you need to go to the hospital. So a doctor will look at the baby and they will commence the baby on intravenous antibiotics, not oral. Baby is not eating, and then they will give the baby drugs to calm down the temperature. So that's tonsillitis for you. Sometimes you will treat it, it will go, it will come back. Sometimes you will think it's malaria. You will treat malaria or the fever will still be there. You will say, doctor, I'm treating malaria. The malaria is not going away. It's not malaria, it's tonsillitis the baby has. I hope you understand this. Thank you, and bye-bye.